Hello, I'm Dr. Namrata Agrawal, a critical care specialist. So today's topic of discussion is what is heart attack inside an ICU and what are the crucial steps that needs to be taken within the first 48 hours. So heart attack is a condition where there is a clot or blockage in the artery of your heart which is supplying the blood to the heart. So without the blood, that is the oxygen, your heart muscles will die, and if the muscle is dead, then the functioning of the heart will be impaired. So heart is a very active pump. It uses major energy or oxygen from our body. So if the energy is not given or the oxygen is not supplied, then the heart muscles dying. That particular portion of the heart to not contract and relax, and the blood pumping will be affected. So if the pump is affected, then the forward flow of the blood is going to be affected. So that is why we need to take all the measures in the first 6 hours to prevent that heart attack from going out of the hand and the heart muscles to worsen. Typical symptoms of heart attack are chest pain, which radiates to your jaw or your arm, but sometimes they may present to us with atypical symptoms like acidity, neck pain, back pain, and sometimes they will come to us with breathlessness also. So heart failure signs may come earlier than the heart attack sign. So once this patient comes to us, we take the ECG of the patient, record all vitals like blood pressure, pulse, oxygen levels, and we check the cardiac markers also from the blood. So this is a special test that we do. Whenever the heart muscles are injured, they releases a special substances inside the blood, and if the levels are high, then there is a suspicion of heart attack. So ECG may sometimes show a heart attack, sometimes they may not show a heart attack. So to reach to a diagnosis of being a heart attack, we might have to do angiography as well. So if the patient is symptomatic but the ECG is not showing anything, the blood test may or may not be confirmatory, then we may have to go for angiography also. If the ECG is showing that this is an acute heart attack, which we call as ST elevation myocardial infarction, that is STEMI, then patient will have to undergo angiography and angioplasty immediately. Generally what we say is door to needle time or door to balloon time. So that is the patient has walked in the hospital, and from there we have taken the patient to cath lab and have performed a successful angiography. So this time needs to be less than 90 minutes. The patient has to be taken to cath lab and angiography and opening of the vessel has to be performed within 90 minutes. So this is the first initial and the most crucial step that we need to do when the patient has come to us with heart attack. After the angiography or angioplasty, the patient is transferred to the ICU, and depending upon the condition of the patient, if the patient has gone into shock, that is blood pressure has dropped down because an extensive portion of the heart has been affected by the stoppage of the blood supply, and the patient may require ventilator support. Patient may require special balloon pump that is called as intra-arterial balloon pump, IABP, which offloads the heart from pumping the blood and gives the heart time to recover. Sometimes if this balloon pump is not working, then patient may have to be put on ECMO as well. So initial 6 to 24 hours goes in managing all the vital functions, gauging what the patient may require next. Patient sometimes may require dialysis support also because the kidney is not getting enough blood supply from the heart because of the weak pump, and urine output has decreased or the heart has failed and there is a volume overload or the fluid has built up inside the lungs or the body part, and the lungs are not performing well of providing the oxygen to the heart. So in that case, we might have to put the patient on dialysis to remove all the extra fluid from the body. So these are all the organ supports or the machinery support that may be required in the first 24 hours. After 24 hours, once the patient is little stabilized in sort that he or she may not require any new support, then we keep the patient on the same support or we try to decrease the support as the patient conditions permit. So in first 48 hours, we get to know most of the situation of how the heart is going to perform and what all other measures will be required. After 48 hours, some patient may be stable, they may go out of the ICU after 48 hours, or some patient may get started to wean from all the IABP support, ECMO support, ventilator support, or some patient may be in ICU in critical stage and they may require all these measures for a long period of time. So this is what we do in the first 48 hours after the heart attack. Please don't be scared. This is just what we do inside an ICU, and not all patients are going to require all these things like IABP and ECMO that I have mentioned. Only very few patients require, but what those few patients who require are generally the patient who come present to us late. So whenever there is a slightest of suspicion that you have an hyperacidity which is out of proportion and you have never experienced that in your life, there is the slightest chest pain, always and always go and get an ECG done. It is a very inexpensive test, but it can save many lives. It can save a lakhs of rupees if it is caught early and it is being taken care early. Thank you.